I think something else is going on. Parents often comment that they are concerned about things that may be tagging along with the ADHD, and they're right, 2/3 of the time. Only 1/3 of us with ADHD have just ADHD. So 2/3 of those diagnosed with ADHD have something else. And one of the most common something else's is anxiety. To make things even more tricky, ADHD can masquerade as anxiety, and anxiety can masquerade as ADHD, or they can both be present side by side. How does ADHD masquerade as anxiety? The overwhelm in the present moment of not getting things done, realizing that you're likely to forget things, poor performance, grades or finances being difficult to deal with, all of those things lead to that overwhelmed feeling. And if you add to that, the default mode network is generating 8 random thoughts while you're overwhelmed, you get a tidal wave of thinking. And the response to that, physiologically, meaning in your body, feels just like anxiety. Anxiety disorders are future focused. They're expectant. What may happen in the future, but probably isn't going to happen. That is what we mean when we say an anxiety disorder. So being afraid to go outside because you might get stung by a bee, that is an example of an anxiety disorder because it's limiting your function over something that's possible but not likely. Many patients that finally come in for treatment of their ADHD have already been treated for anxiety with varying results, but usually not great results. And treatment with ADHD slows down the default mode network, increases the focus network. They feel more capable, more reliable, and that produces confidence. And confidence is the enemy of anxiety. So to help illustrate the point, let's play a little game. Put yourself in the place of little Johnny's parents. They've just gotten an email from the teacher saying he is not completing his work, he's staring at the paper and not even starting, or that he refuses to do the work, so he's being oppositional. That sounds like ADHD, right? Fiddle farting around, not being willing to comply because of being off task. But could it be anxiety? If little Johnny has already asked the teacher for clarification a few times, she's likely scowled at him and let him know that that's not appropriate, that he should just follow the directions. Or he may be embarrassed to ask again because his classmates may laugh. At the end, if he's not certain what he's supposed to be doing, the risk of him being embarrassed are too great for him to start the process of doing the work. And so he finds something else to do, doodling, rummaging in his desk, or just sitting there frozen, which is a shutdown response to anxiety. The other side is that he may have a meltdown if he's feeling that fight response to the anxiety. And this is so important because so many behaviors look like ADHD when we don't have enough information. And that could mean increasing ADHD medicine to improve symptom control for inattention, and that can lead to increased side effects. So knowing where the hitch in getting the work done is vitally important to prevent overtreatment of the ADHD. So that is how treating ADHD can actually improve anxiety symptoms, and especially that overwhelm we mentioned. It's important to realize the interplay between ADHD and anxiety and do some self-reflection on whether it's one thing or both things, and if it is both things, which one seems to really be driving the boat at the present time. Because when it comes to treatment, we can only go after one at a time. So reflect on anxiety being anticipatory or future-focused worry, and ADHD overwhelm being more in the present moment with what is not getting done in spite of the fact that we know it needs to be done.